Hello, my name is Nancy Jacobson, and I'm an assistant professor of emergency medicine at the Medical College of Wisconsin, where I'm an ED medical director and the systems director for quality, safety, and experience. Today, we're going to talk about how do we measure patient experience in the emergency department. First, I'd just like to emphasize that patient experience matters. An excellent patient experience has been shown to improve physician experience, decrease legal risk, and improve patient compliance, which in turn improves clinical outcomes and quality measures. For more information about how patient experience matters in the emergency department, please refer to the preceding lecture in this series, Patient Experience in the ED, Why Does It Matter? Patient feedback can be obtained in numerous ways. Through leader rounding on patients currently in the emergency department, through follow-up phone calls from physicians, administrators, or nursing, and through patient satisfaction surveys. For the remainder of this lecture, we're going to focus on patient satisfaction surveys. The most commonly used surveys are the CAHPS surveys. CAHPS stands for Consumer Assessment of Healthcare Providers and Systems. Varying surveys are used based on the clinical practice environment. For example, the ED CAHPS survey is utilized to measure ED patient experience. Meanwhile, the HCAHPS survey is utilized to measure inpatient hospital patient experience, and the CGCAHPS survey is used to measure outpatient ambulatory practice patient experience. The CAHPS surveys were developed in 2012 by CMS, and they were developed using guidelines from the Agency for Healthcare Research and Quality and the CAHPS Consortium. These groups came together to develop surveys that included key demographic items and 35 questions about ED patient satisfaction, spanning the time from arrival at the ED, care during the ED visit, through ED discharge. Patients who are eligible for this survey are adult patients 18 years and older who are discharged from the ED. CMS estimates that this group comprises 90% of all ED visits. Ineligible people are patients who are under 18 years old, who are not discharged, law enforcement patients and prisoners, patients with no United States address, and patients who request not to be contacted. The ED CAHPS survey can be distributed in many ways. Many hospital systems utilized a mixed modes distribution pattern, meaning they can mail the survey with a phone follow-up. There can be a web-based survey with a mail and/or telephone follow-up, or a combination of any individual distribution method. Surveys are available via text message, email, and mail. They are additionally available in 5 languages. Hospitals may individually distribute CAHPS surveys. However, most large hospitals and healthcare systems utilize a patient satisfaction survey vendor. The largest and most commonly utilized survey vendor in the United States is Press Ganey and Associates. ED CAHPS results are interpreted using a top box score. This score is the percentage of the time that a patient rates a given question as a 9 or a 10 on a 10-point scale, or as a 5 on a 5-point scale. For example, If a group of patients is asked to rate their overall ED care and 80% of those patients rate their care as a 9 or a 10 on a 10-point scale, the top box score would be 80%. However, if all of those patients rate their care as an 8 out of 10 on a 10-point scale, the top box score would be 0%. This example highlights that the top box score and EDCAPS survey data is not reported as a mean or as a median, but rather as a top box, meaning 9 to 10 on a 10-point scale or 5 on a 5-point scale. As mentioned, Press Ganey is the largest survey vendor in the United States. This survey vendor collates data for hospital entities, and data can be narrowed to individual physician. The minimum number of responses to make a judgment is 30 to 50, and the minimum number of responses to report at all is 7. Survey vendors, including Press Ganey, are careful to state that the minimum number of 30 to 50 is to make a judgment. It is not statistically significant. Many emergency medicine professional societies and physician groups have made statements about interpreting EDCAPS data. An example from ACEP includes this quote regarding the validity of interpreting Press Ganey results and sample size. It states, while Press Ganey does not release the internal statistical calculations and goals of its survey tools, independent review reveals that depending on the size of the ED population, for the ED as a whole, 30 to 50 results could provide as low as 50 to 55% confidence interval. In order to create the generally accepted 95% confidence interval, 175 to 225 surveys would be necessary for a scaled survey, which is the methodology that the company uses. This will become an important point to remember when discussing how to interpret and employ data that is obtained by patient experience surveys. And we will discuss further in the next few slides when we discuss the limitations of patient experience survey data. Let's jump right in and talk about some of those limitations. When we examine the inclusion and exclusion criteria for which patients are surveyed about their experience, the CAPS Consortium recommends that 90% of the patients are discharged and eligible for the survey. Nonetheless, depending on the acuity of the patient population and the admission rates of a given emergency department, this may not be applicable at the local level. Additionally, time and resources are prioritized to the sickest and most likely to be admitted patients in the practice of emergency medicine. Therefore, one of the challenges and limitations to the survey is that the patients who are more likely to be surveyed are also those that are more likely to wait longer than the higher acuity triaged patients. Additional limitations. Mail-based surveys eliminate those without permanent addresses, and written surveys skew data towards English-speaking patients. This limitation has been mitigated by the increasing number of languages in which the EDCAPS survey is now available. Additionally, from a statistical standpoint, mean and standard deviation vary increasingly when evaluating smaller populations. Therefore, results and trends are not comparable across small populations. This suggests that survey data should be used to compare a physician or a hospital to itself over time, rather than comparing physicians within hospital systems or hospitals within regions. Nonetheless, this is often how hospital administrators and healthcare systems utilize patient satisfaction surveys. When considering how EDCAPS data is utilized, it's important to consider the following three questions. Is the data the best available? Who is the target audience? And what process improvements is the data driving? We've already discussed the importance of understanding the N and the implication of the number of survey responses when it comes to trending over time as opposed to comparing physicians or institutions across a region. Additionally, survey vendors can match your hospital to similar hospitals in your cohort. For example, a 100,000 visit community ED is not the same as 100,000 visit urban ED with a residency program. Multiple factors should be considered when looking at matching your ED with its cohort. It's important to understand the target audience and what process improvements this data is driving. Target audiences may include hospital administrators, departmental leadership, and also the public. Much of the patient satisfaction data is now reported publicly and easily accessible. EDCAPS data can be effectively utilized to drive process improvement and advocate for additional resources in the emergency department. For example, decreasing door-to-provider times, decreasing turnaround times for lab and radiology studies, and overall decreasing ED patient length of stay have been shown to improve patient satisfaction scores. As operational leaders in emergency medicine, it is important to understand these factors, their impact on patient experience, and how EDCAPS data can be utilized to drive process improvement and resource allocation in our hospitals and healthcare systems. Thank you very much for your time and attention as we discussed how do we measure patient experience in the emergency department.